breastfeeding is said to be the most nutritional form of feeding for your baby and newborn, but at what point are we able to take back our breast when the nutrition ceases to help our child anymore? Helping us discuss this issue is Jennie Joseph, midwife and also executive director of the Birthplace. So thank you, Jennie, for joining us and helping us, for some of us, take back our breast. Because, you know, here's the thing. Some women breastfeed until whenever, God, you know, and I think a lot of women, I don't want to say I don't know, but a lot of women don't know when it is okay to stop, when it is no longer, I guess, nutritional anymore for the child, if that is even possible. Can you just give us some insight on when do we stop? Why don't we? When, honey?
Well, I'm always excited when women breastfeed at all. But yes, it is a dilemma, because some babies will wean themselves, and that's the end of the situation. You don't have to worry, problem solved. And then other babies decide that, no, I really like this, and I'm just going to keep going. And left alone, children will continue to nurse. Maybe not for nutrition anymore, but for comfort. So an average, and the recommendation by the World Health Organization is about 2 years. The American Pediatrics are also going to say at least 1 year. But certainly, you know, you want to allow the child to fully wean into having solid foods and other nutritional drinks. But the breastfeeding issue is quite controversial, and it depends on where you are in the world, how you feel about it. And the American way of thinking about it is quite different, let me tell you, than other countries that I've worked and lived in. So it's really a personal issue at the end of the day.
And I'm glad you say it's a personal issue, because I don't have any children, but I do plan on having children. And I've always told everyone that I've decided that I don't want to breastfeed. And it's it is for it's for vanity reasons. It's for a lot of reasons. I figure, you know, at 21 years old, the kids are going to move out of the house, and I have to live with their dad forever. So I still want to be sexy for the father.
You get a boob job.
Well, if I don't want to have a boob job, I won't get a boob job. But I'm just saying, so it's for vanity reasons. And so I've just made up that decision. Now, I'm an African woman, so I totally agree with you, because in Africa, it's automatically assumed, it's automatically, and Kaya can agree with this, that mothers, you breastfeed. However, you know, we'll talk about the HIV thing, where mothers can, you know, breastfeed because of HIV. But why is it now in the 21st century that society frowns upon a woman who decides that she will not breastfeed? Like, what is wrong with me deciding that I don't want to breastfeed?
Please,
everything is wrong.
Take it over.
Please tell her.
Let Jennie speak.
Absolutely. Nothing wrong, because it is a personal choice.
It is.
Here's why we make, I think those of us professionals who are very supportive of breastfeeding and encourage every woman to breastfeed if she can, we're coming at it from an angle of, this is a thing that is a continuation of the pregnancy. So we have this ideal, the baby's born, it's all over. Well, actually, no. Your body has produced milk to continue that work. So while baby's inside of your tummy, you have a placenta providing that. Once the baby's out, the breast milk takes over that job. So from a medical professional standpoint, that's just a continuation of the pregnancy. If you will, it's like the second half of the pregnancy. While you're lactating, you're providing for the baby that you've nourished and grown to term, hopefully, inside of you, and you continue that work outside of you. So for us, it's just a continuation. But just like a woman will choose in her pregnancy, I'll have my baby at the hospital. Oh no, I'll have my baby at the home. I'll have my baby with this type of practice. Those are choices that you make as you go along, and those are yours to make. And no one has any jurisdiction over that.
Wow.
Ultimately, every woman wants a healthy baby.
Yes,
that's true. That's the bottom line.
And they've come up with they've come up with infant formula that is not the best. I mean, it's not. It doesn't equal or is the same as a mother's milk. I understand that, but it's adequate, and I think you can do a lot of things too, because there are some kids who do. How about HIV positive moms?
Well, it's a different situation.
But how is it different, though?
You know, just to add on to what she's saying, which will bring my question, it's so sad for me to be sitting on a couch with an African woman who doesn't want to breastfeed.
I love it.
I'm from Africa. And with me, I've looked at it like this. You know, you have a baby. Why is it you make it? Well, I'm vain. We all know everybody's vain here. But, you know, at one point, it's a decision. I mean, vain is actually stamped on a forehead. But, you know, it's a decision that you make because you want to be sexy, which is great. But, you know, there are a lot of good things that are there in the breast milk for a child. So why make that decision for you and not your child? Which is great, but, you know, you can answer that to her later. Well, because I have my question for you. You know, I'm from Africa, like she told you. Very sad that, you know, she doesn't want to breastfeed.
Do we have to talk about that?
But why is it a taboo in America when a woman is feeding a child in public, because in Africa, you know, I mean, I can be in the bus and right there, I just when my child cries, you know, why is it taboo here? Because I remember I read something in the news and a woman was being sued or something because she was breastfeeding in public.
There's a lot of stories like that, and in fact, Florida had to create a law to protect women. We actually have a law in Florida that says you may breastfeed your child wherever you are.
Okay, perfect.
But you're right. The question is, why is there this taboo? Why is this concern and almost horror that a woman would use her breast for that purpose, when we've forgotten that's what the breasts actually are for.
Exactly.
But in the sexualization of women, and particularly in their breasts, we have this whole ideal that this woman is wantonly trying to expose herself, and that has a sexual connotation. And that's really sad, and I agree with you. I'm just very frustrated with that. But ultimately, yes, the woman should be able to feed her baby wherever she wants. Imagine having to take your child into the restroom
to feed your child.
Exactly. Or go somewhere private.
Yeah, I mean, that's not right.
No, I've had 2 children, and I breastfed both of them.
Yes.
But I do think that there is an optimal time for when you need to stop breastfeeding your children. I don't think 3-year-olds, 4-year-olds should be coming up to their mother, pulling out breast out in public. I mean, that is just absurd. I'm sorry. Well, yeah, and I breastfed my children up until, 11 months.
Okay.
The other one he was just kind of like,
I'm ready to wean.
Yeah, I'm done. Yeah,
yes.
like he was like, I don't want to be here. I don't like it. I'm done. Right around 7 months. But, I do think it's healthy. But I do think there should be, it should be a law.
Is there a cutoff?
Okay.
Enforce a law.
You can't, because you'd have to call the breastfeeding police. I mean, that would be all that would be left, because every baby, just like every mother, is individual and will make their decision.
Right.
Children that are nursing at 3 or 4 years old obviously are doing that because that's something they want to do, and the mother is allowing or accommodating that.
Yeah.
But the fact that the child is looking to do that suggests that perhaps children left alone would continue to breastfeed.
Yeah.
So it is, again, a personal choice, and I don't know whether there's a right or wrong with that.
We actually have 3 and 4 years old.
But for the child's perspective, obviously not. They don't really seem to care. They go on with it.
Okay.
But the adult would have to make that determination. I'm going to stop. I'm going to cut it off for you. But again, what would be wrong? What's the harm there? It's not for nutrition at that point. It's for comfort. It's for bonding. It's for connection.
I thought we bonded the first few months.
At that point, man, that's apparently what people say.
We actually have an image of a 7-year-old a child that's breastfeeding, and in Australia they tend to extend. In other societies, communities, they do extend it to 7 years to a lot older. And I think what you mentioned though is, for comfort's sake, maybe the child just wants maybe a child just wants the comfort. But like you said, my research was saying to me that both the mom and the child, they do decide that this is over with and it's done.
I wonder, at 7 years old, what, you're in 2nd grade, what do? You ask your teacher, call my mom because I need some breast milk? I mean, seriously.
But Jenny, how does that work? Because, okay, if the nutritional value has stopped and now they're breastfeeding for comfort, shouldn't we be doing something else to comfort our children?
Absolutely, absolutely. And I think this is a very unusual situation. You don't see many, really. I mean, there may be some 3 or 4-year-olds. 7-year-old is quite unusual. And really then you wonder about that relationship. But again, how do you police something like this, especially something that's done at home and in private for the most part? Again, looking at the nutritional point of view, the recommendation is up to 2 years. And I think that stands. After that, a child is eating other foods anyway. There would not be any child who's purely breastfed at those kinds of ages. So it's not for nutrition at that stage. But I don't know if we can categorically say that that's wrong or that mother is bad. I think you have to go with, again, and it comes back to your point. We all have personal choice. Purely give the information and allow people to decide for themselves.
Right.
What's right for you is not right for another woman. But some other woman would say she wouldn't even breastfeed for 7 months because, oh my gosh, I couldn't do it. And here you are. You've done 2 children past 7 months. And they benefit from it.
Did you?
Sure.
I tried. See, well, I didn't have these when I tried to breastfeed.
It's not about the size.
But
it's
there
absolutely
was
not
when
about
did
the
it come
size.
out. Like, I think the first child was 3 weeks, and that was it.
A lot of times, I really have to say this, Erica, there's a lot of misinformation, and there's a total lack of support, I'm afraid, and especially in America.
Right.
The consensus is not to support and encourage breastfeeding. It's the total opposite. Why? Because formula is king. Formula has taken over our mindset. And so for women like yourself who choose not to, that's great that there's formula. But the way we market formula and the pushing of that product to the American public, I mean, every other new commercial, now with added whatever. We're continually searching to try to emulate something. You cannot produce human milk.
No.
Just like you cannot produce human blood.
No.
You wouldn't want powdered blood mixed up in the back room to be given when you need a transfusion. You want the real thing that matches you, that is safe for you, and that is going to nourish your body.
Right.
So what we have here is a very strong formula industry, and we have nurses and practitioners who are not that sure how to support a mother with breastfeeding.
Yeah.
If you were transported when you had your child and you had 3 weeks to get it right, and you had no other choice but to breastfeed, you'd be breastfeeding.
Yeah.
Wow.
Because
your body would produce, your mind would relax, all that nervousness and panic would go away. You just get on with it.
I wasn't
Is
nervous
it-
and
is it-
was
Of
a whole
course
bunch
you
of
were.
panic.
Is it
Yeah.
true? Is
Of
it?
course you were.
Is it
And
tr-
lack of support.
Now, is
Yeah.
it true that even if you were to get a baby and she was to start doing a sucking motion on my nipple, that after time you can begin to lactate
Oh,
and begin to
absolutely.
produce
Absolutely.
milk for the
Even
child?
mothers who've adopted children have been able to relactate if they've lactated before. This is something that I don't even think we have enough science. You know, there's an entire industry around breastfeeding information, knowledge, and support and education, because we still are learning. You cannot, it's just like pregnancy. Really, who understands pregnancy? Think about it.
I
Do you
don't.
know, seriously.
I've never been.
Isn't
I
it
don't.
amazing? It's a
I
total
think it's
miracle.
amazing.
And we still don't really get it. I mean, as a midwife, I've learned to just leave it alone because it takes care of itself.
Okay.
You know, and likewise with breastfeeding. Some women need some support and some don't. But those that need the support really need the support to be successful.
Now, talking about support, how about HIV women? Kai and I are from Africa, where unfortunately we've had such a tremendous impact of HIV and AIDS on the continent of Africa, and formula is very foreign to us. It's the last resort, really.
Yes,
a woman
absolutely.
should breastfeed her child.
Yes.
That's what we are. That's what we are taught. I'm wondering, what as a midwife, what is your recommendation to women that have given birth but are HIV positive?
It's
what
really
should be the
difficult,
remedy?
depending on her situation. If she's on her antiretroviral drugs, she's okay. But if she isn't, then we also have to weigh up, is it safer for her to breastfeed the baby versus not have an opportunity to give the baby the correct food or clean water to mix the formula? You know, there are various variables that you have to consider on an individual basis. Really, what is the risk versus the benefit?
But the World
And that's
Health
difficult.
Organization says that the transmission of HIV through breast milk is very, very minimal.
Yes.
So
we
yeah,
want
it's very,
a
very
mother to
minimal.
breastfeed whenever she can, and we want to encourage that. And again, you know, for the bonding of the baby,
Yes.
this is key in this case. This woman who's not well, she needs to really connect with her baby for the safety of the baby. But it is very difficult. It's very individual.
Okay. And talk to us about your facility. You have an amazing facility,
I do.
and
Yes.
you help women
Well,
give birth.
Yes,
What's that
that's
all
what
about?
I do.
Yeah.
I do that supportive role. As a midwife, I'm really interested in the natural process. We found that for women that, well, here's the thing. Take a breath. Here's the left alone.
I'm about to have a seizure right now.
If you've had the support and the education, you will have the baby. You know, if the hurricane
With
came
no
through and blew away
epidural?
the hospital
No epidural.
and you labored, without the epidural, you would deliver. Because babies come out, right?
We're so conditioned to believe that childbirth can only happen, because I'm like, kind of have never had any kids, but I'm thinking, oh my God,
You won't be
C-section, whatever, natural, I need something just to numb me from the pain.
Well, what I want you to keep in mind is this. Every woman can have a baby, for the most part. There are a few women that can get a baby through. Everybody else is fine. And what we've done as midwives is we've said, let's look at this from another angle.
Please teach me.
That really, take on the point that you will have no problem having this child, because having a baby is not an illness. Do you see? There's nothing wrong with you. So we start from that paradigm. We work from, it's just a completely normal event in your life.
Yeah.
Okay? Then you have some information and some support, some education. And by the time you reach term, you're so empowered and you feel strong enough in your body that you want to give it a chance.
Right.
If you allow yourself to see how you do, you might be one of those women, and there are many of us who actually sailed right through this event and come out the other end with, oh, it wasn't so bad. And then for the 50% of us that need some help, help is always available. So as a midwife, I'm not saying you cannot have medication or you shouldn't have an epidural. What I'm saying is that make sure you have all the information you possibly can and then go from there.
I need you to help me.
I'll be right there.
I mean,
I'll be right
watching
there.
childbirth, I watched child. I think that traumatized me. I've always say that. You know, just watching the
Well,
baby
you're watching
come
TV
and
childbirth.
No. I
Everybody's
was
screaming.
actually in the room.
Oh, I see.
And my niece was giving birth. And
Okay.
my mind right now about childbirth, I
Okay.
mean, I think I'll need epidural in my ears, in my eyes.
Bless your heart. Bless your heart.
You know, I have to say, at some point, I do think maybe women are different, because I have a sister-in-law who's had 4 children, no epidural. As soon as she gets in, they're
done.
out.
That's
like
right.
I had to get 2 C-sections
Exactly.
because I couldn't go, you know, my babies couldn't go through.
Everybody's different, and you don't know until you're actually in that labor how things will go. It's almost like a trial of labor each time you have a baby. We don't know. So we take the lowest common denominator, we go from a point of it's going to be okay, but if we see anything going wrong, we can act and we can move on to the next level, which is either intervention, C-section, whatever's needed.
Okay. One word. Yes. What is your Africa?
Mother.
Oh,
wow.
Beautiful.
That's beautiful.
So as we have learned here through our information, it is a serious personal choice. No one else should come in between what your choice is for you and your child. Stay tuned and be informed.